Hello everyone, welcome back to another recall session. So today we're going to discuss about the anatomy recall questions of NEET-PG 2018. So let us start discussing the questions. The first question is identify the thickened nerve marked in the arrow in the image shown below. This thickened nerve is actually the greater auricular nerve, and this is also the greater auricular nerve that the arrow is pointing toward, and this one is transverse cervical nerve. So the nerve marked in the image shown below is greater auricular nerve. The answer is A. The next question is the Broca's area is situated in the. So Broca's area is the motor area of speech. So that is the area number 44 and 45 according to the Broadband classification. So that area is situated in the inferior frontal gyrus. The next question is which of the following cranial nerve nuclei is not a part of the spatial visceral efferent column? So let us look at the options. Facial nerve? Absolutely yes. Trochlear nerve? No. It is not the part of spatial visceral efferent column. Vagus nerve and glossopharyngeal nerve? Yes. These both are the part of spatial visceral efferent column. So the answer here is B. Trochlear nerve. The next question is the joint between the attachment of the 8th and 9th rib to the 7th rib is. So this joint is actually known as interchondral joint. An interchondral joint is actually a type of synovial joint. So the answer here is C. Synovial joint. The next question is what is the last fontanelle to close? The four options are anterior, posterior, occipital and mastoid. So anterior fontanelle closed by 18 to 24 months. Posterior fontanelle closed by 2 to 3 months. Occipital fontanelle closed by 2 to 3 months. And mastoid fontanelle is closed by 6 to 18 months. So the answer here is A. Anterior fontanelle is the last fontanelle to close. The next question is which among the following is incorrect regarding Simpson's fascia? So the options are attached to the inner border of the second rib. No, this is wrong. Simpson's fascia is actually attached to the inner border of the first rib. The next option is covers apical part of the lung. So yes, this one is correct. Next option is part of scalenus minimus muscle. Yes, it is the part of scalenus minimus muscle. And the last option is vessels pass above the fascia. Yes, vessels passes above the Simpson's fascia. So the answer here is A. It attached to the inner border of the first rib, not the second rib. Okay. The next question is the structure not passing through the aortic opening of the diaphragm is. First of all, let us discuss what are the structures passing through the aortic opening of the diaphragm are aorta, azygous vein, thoracic duct. So the answer here is D. Vagal trunk is not the part of aortic opening of the diaphragm. It is the part of esophageal opening of the diaphragm. So the next question is the hard palate contains keratinized, stratified, squamous epithelium, submucosa, minor salivary glands. So hard palate contains keratinized stratified squamous epithelium, submucosa and minor salivary gland. So the answer here is A. The next question is what is the function of the muscle marked as A in the image below at the metacarpophalangeal joint? So let us label these four alphabets. A is lumbrical muscle, B is abductor pollicis brevis, C is flexor pollicis brevis, and D is abductor digiti minimi. So the answer here is A, flexion, because flexion at metacarpophalangeal joint is produced by lumbrical muscle. Let us move on to the next question. Which among the following is a tensor of vocal cords? There is only one tensor of the vocal cord, that is cricothyroid, because lateral cricoarytenoid is the abductor of vocal cord. Thyroarytenoid and posterior cricoarytenoid are the adductor of the vocal cords. So cricothyroid is the tensor of the vocal cord. So the answer here is A. The next question is the nerve of the second brachial arch is. This is a very simple and straightforward question. The answer is C. Facial nerve is the nerve of the second brachial arch. The next question is which of the following statements is true about the iliopubic tract? It is a thickening of the lumbar fascia. This is wrong. It is actually the thickening of the transversalis fascia. The next statement is it lies anterior to the Popper's ligament. Popper's ligament is the second name of inguinal ligament, and it actually lies posterior to the inguinal ligament, not at the anterior side. It inserts into the pubic tubercle in front of the conjoint tendon. It inserts into the ischial spine, not pubic tubercle. So this statement are wrong. It fans out with fascia iliaca laterally. This is completely true statement. Okay. So let us move on to the next question. Ureteric bud develops from simple, straightforward and factual question. The ureteric bud develops from A, mesonephric duct. Okay. The next question is the heart starts to beat in the blank, fill in the blank, week of development. The blank is the number of week. So this is a factual and straightforward question. The heart starts to beat in the Fourth week of development. So the answer here is fourth week. So with this, we complete our session of anatomy recall questions of NEET PG 2018. So thank you so much for watching and see you in the next one.